Hello and welcome. My name is Brian Sedella, and I am the president and founder of Forever Young Med Spa. And today we're going to be discussing the underlying causes of aging and, most importantly, what we can do about them. And there is a lot. This picture, or this set of pictures, depicts a daughter in her early 20s and a mother in her mid 50s. And looking at that, you'd say the mother has aged very gracefully, which she has. You can definitely see that they're related. But let's take a closer look. Look at the daughter's face from under her eyes through her mid-face area. Notice how round it is. And as you come around, you can see kind of a very round-looking face in general. She was born that way, and as time goes forward, she'll look more and more like her mother because we can see in her mom what's happened. We can see she has lost a tremendous amount of volume or fat in these areas, under her eyes, her cheek, her lower face. Her jawline now is beginning to sag a little bit with laxity, and that's not because she has excess amount of skin to begin with. It's because we lost fat here, and as that fat loss, there's nothing to hold the skin up, so gravity can't be denied, and everything begins to sag. Wish this had begun at age 25 because that's where the loss of fat begins. Not that anyone at 25 needs 4 syringes of filler, but that's where the loss of fat begins. And you can clearly see between 35, 45, and 55 how that volume of fat forces everything down. Again, can't fight gravity, and that's just a simple fact. Easier to see though when we strip away the top layer of skin and look at the underlying fat layers. And you can see from 35 to 55 what's happening. The fat begins to degrade, separate, and even sink. And that's what causes everything to go down. That lack of scaffolding that we need to keep the skin up is reduced through age. Typical signs of aging would include frown lines in the forehead, crow's feet, sunken cheeks, loss of volume in lips, and you can clearly see that left to right, the loss of volume in the lips, deep folds around the mouth, and wrinkles, sagging jawline. So from a daughter in early 20s to the mid 50s, you can definitely see, especially along the jawline, you can see what happens as the skin begins to drop because there's no support system up here. So when you come into Forever Young Med Spa, where we practice natural look aesthetics, we're going to look at you with a critical eye. We're looking at 3 primary areas: your upper face, your mid face, and lower face. And then we concentrate on the specific areas such as your temples, your mylar area, your cheek area, your nasolabial folds, your marionette lines, how your jawline contours, and how your chin wrinkles, so we can get an idea of where the most loss of volume of fat has occurred over time. Now, there are 3 really primary areas of rejuvenation. So there are laser-based or radiofrequency-based type of technologies. There's injectables, which include Botox and Dysport and Xeomin and a whole host of different fillers. And then there are surgical options, which include liposuction, face or neck lift, and fat transfer. Let's look at a closer look at some of the options that we specialize in at Forever Young, where we combine frequently multiple technologies to address and reverse the signs of aging. So the neurotoxins such as Botox, Dysport, and Xeomin, which some people make the error of thinking they actually put back volume. They don't. What Botox, Dysport, and Xeomin accomplishes are to relax the dynamically caused lines and wrinkles, primarily in 3 areas: your forehead, your glabellar, or the L's between your eyes, and crow's feet. Then there's the fillers, and there's a whole host of fillers between Sculptra, Juvederm, Juvederm Voluma, Volbella, Bellatero, Radiesse, Restylane, Restylane Lift, Restylane Silk. There's a whole lot of different fillers. And for us, they're just tools in a tool chest. We typically combine multiple fillers to achieve what a patient wants to achieve. But those are the 2 areas most common. The third and I liken fillers to a cake batter. And what I'm about to talk about next is the icing on the cake, and that's using radio frequency devices for skin tightening, lasers, and other technologies to remove sun-damaged skin, age spots or sunspots, remove broken facial vessels called capillaries in your face, and to give your face a more luminescent type of skin tone. That's what lasers do. We can also address items like acne scars or even facial scars, but by addressing all three areas, relaxing those lines and wrinkles caused by your muscles through Botox and Dysport and Xeomin, using traditional fillers to put back the fat that time and nature has eroded, and lastly, using lasers to improve the skin tone and texture of your skin. So you didn't age overnight, so you shouldn't anti-age overnight. It takes time, and this is a journey. But once we begin the journey and 4 to 6 months later, you've gone through, you're receiving regular Botox and Dysport, you've had a proper revolumization of the areas of lost fat, and you've taken away the sun damage, the aged skin on the top layer of your skin, you can then look 10 to 15 years younger, and more importantly, keep it that way. I'm often asked, what's my favorite filler? And that's a difficult question to answer, but as time has gone on, I think I have the answer, and it's called Sculptra. Sculptra is a little bit different filler than most other fillers. It's called injectable PLLA. So in layman terms, if you've ever had surgical procedure and you've had internal sutures used, they use PLLA. And it's unique because it forms, if you look at the refine area on this slide, this is what it forms, a scaffolding under your skin where collagen and elastin fibers then rush to rebuild the area. And rather than talking about it, let me show you some before and after pictures. So I think if anyone came in or saw this 30-year-old woman, they would say she looks pretty good for her age. Not a whole lot of aging going on. But as we replaced the lost fat, even in a 35-year-old woman, you can see by revolumizing this area, it made some profound changes here. Look at the left side, look at the right side, and the jawline itself became more rounded, more shapely, and more youthful. Another younger patient, 41 years old, I don't think anyone would say, because she already has a somewhat round face, that she's lost a lot of volume. But when we revolumized this area, the flat was not much here, it was really in her midface. She lost volume. And by revolumizing this area, everything lifted. Her jawline became more contoured and her face became more symmetric. And I think she looks, 7 to 10 years younger than she did in her before picture. This is a 58-year-old woman who had a lot of fat loss from her upper face, mid face, and lower face under her mouth. And you can see the profound difference. And this is 3 months after her third kit of Sculptra. So she had 3 kits over 3 months, and you can see the difference. And that's going to improve with time because Sculptra is unique in that once you come in for a fill, a few days later, you're not going to look much different because the saline in that fill is gone. And that's where PLLA works its magic in putting down that scaffolding so that the collagen and elastin fibers rushing to the area are going to use that scaffolding to rebuild and add on the fat, if you will, that you've lost over time. I love this slide, the side view. 43-year-old patient, and looks pretty good. I'd like you to take a look at the before picture, though. Look at the jawline, how when we have fat that is degraded in the upper face, you can't fight gravity, everything starts to fall. When you replace that with Sculptra and you do a proper revolumization, everything lifts, and look how beautiful her contour of her jawline became. And men, and we're seeing more and more men. Our practice, when we first began in 2005, we almost never saw men coming in. As a matter of fact, when a guy would come in, I'd run out and hug him because I was getting estrogen poisoning from all the women. So guys now make up almost 40% of our practice. And this before and after picture shows why. Now, guys come in for different reasons. Guys don't come in saying, I want to look prettier or younger. Guys come in and their two main areas of concern is, I want to look less tired and I don't want to look angry, because they get those, those deep furrowed brows and their mouth starts to turn down and they look angry even when they're not. So you can see in the before and after picture just the profound difference that two different vials or kits of Sculptra made in this man who was 43 years old. This next slide is on Dysport. The L's between the eyes, you can see the difference. Typically, the Dysport sets in 5 to 7 days, although at day 14, you can see the difference is now permanently set in for that. I shouldn't say permanent. It's for the duration of the treatment, which, by the way, most experts will say, most studies have shown that Botox, Dysport, and Xeomin last on average 90 days. Some patients will get 120 to 150. Some patients will get 60 to 90, but as an average, it's 90 days. Restylane Silk, one of my favorite fillers for the lips. Very, very soft, very easy to work with, and as you can see, a very, very natural type result from before and after. Let's talk about some treatment recommendations, but before, I love this slide because I think anyone who's watching this can tell me, looking at this identical set of twins, which twin was receiving regular Botox and Dysport and which twin was not. It was a 13-year study, as a matter of fact. And in year 10, the twin who was not receiving regular Botox and Dysport decided, I can't do this any longer. I'm going to start taking Dysport and Botox, and because she was tired of her sister looking 10 years younger. But you can see in this wonderful study just what a profound difference regular use of Botox and Dysport makes for the aging process. And by the way, our fastest growing patient segmentation are patients 25 to 30 years old, even younger, coming in to use Botox as a preventative so they never get crow's feet or lines in their forehead or the L's between the eyes. Now we're going to talk a little bit about lasers and this specific protocol, which is relatively new. The devices aren't new, but the protocol combining two lasers together is rather profound, and we're going to talk about that next. So as we age, we commonly feel our skin kind of looks tired. It's just not as vibrant. It doesn't reflect light as it used to, and it just kind of looks kind of crepey and just in general older. So we're now combining two different technologies, a 1540 fractional erbium laser and a IPL called a photofacial, and they accomplish a couple things. The photofacial is going to get rid of that molten type appearance, all those little age spots and sunspots, brown spots on your face. And the 1540 is it's a collagen producing machine. It lays down collagen like almost no other, and it can improve your skin tone, texture. And as you can see in the before and after picture, look how her skin glows, the luminosity, how it reflects light before and after. Another patient using, again, the combination treatment, the 3-for-Me protocol. And you can see the molten, the sun damage here on her cheek. You can see a kind of a little deeper lines and wrinkles. And one of the nice things about the 1540 combination with the photofacial is you do get a little bit of skin tightening. You do a little bit of skin contraction. This is without fillers. This is just using the combination 3-for-Me protocol. Now this young lady, who is 61 years old, had a different type of effect from using the combination therapy. You can see under the eyes, the crepiness, the lines, the wrinkles, softened dramatically. Now, I'm not going to tell you this is a facelift. I still believe that if you're a patient that needs a facelift, you're going to need a facelift. Lasers can only do so much. But in most of the population that comes in saying, I don't want the downtime, I can't afford to miss 2 weeks of work, the pain, the recovery, the anesthesia, and I want to do something to improve, in most patients, we can get a 40 to 60% improvement. And I think you'd agree in looking at these before and after slides, that's exactly what this patient achieved. 73-year-old patients, and yes, this is for grandmas too. And although, again, I wouldn't pretend to call this a facelift, you can see just how much younger she looks. Her skin looks healthier. All those tan, brown spots are gone. And she's had a modest improvement in skin tightening and the skin tone and texture of her skin. And that's it for this presentation. I'd like to thank you for attending. And if you have any questions, please call our office at 954-450-2626. And if for Everything Med Spa, we welcome you to come by for a complimentary consultation. In South Florida, why age less when you can look and stay forever young?